Hello everyone. This is the second video that explains the remaining reports in the health information system Eid Wahdeh. I advise you to go back and see the first part, which explains the reports that are, we called it the general reports category. In this video, I will explain the remaining reports, which are the graphical reports and the nutrition reports, and also the Excel report. Before we continue, I just wanted to do a revision about the main concepts that we have in the system. So we mentioned that a patient can do one or more visit, and in the visit we can make one or more consultation. So whenever a patient visits multiple clinics in one visit, so each visit to a clinic is called a consultation. So as an example, uh, a patient can, let's say we have 10 patients in a specific month, might do 100 visits, and in those 100 visits we might have 200 consultations. So the relation between these concepts is the visit is always greater than or equal to the number of patients, and the consultation is always greater than or equal the number of visits. Also, we said that in each visit the doctor might give the patient one or more medication or one or more services, or he might write one or more notes. Also, he can discover one or more diagnoses, which is based on the ICD-10 coding system. So this is the general concepts behind the report. So if we go back to the system, so as I mentioned that in the first video, I explained the main category reports in the system. Now we will explain the graphical reports and the nutrition reports and the Excel report. As you can see here, these are the main categories. We explained these in the previous video. So now we will go and explain the graphical reports. Let's start with the top 10 medicine. As the previous reports, also here we can specify in which year and which month we want to generate the report. In this example, we can take this year, 2009, in October as an example. And also, as I mentioned previously, each report has these controls on top. So when the report is generating, these tools or controls can allow us, as an example, to save the report in different format as Excel, PDF, or Word. Also, if the report contains multiple pages, we can go to the previous or next page here. Also, we can change the size of the report. So in this example, I will make the size like this. So this report, going back to this report shows the top 10 medicine or medication in this center. So this is the center code. In this example, it's a center that exists in their zone. And this is the year and month. And if we see the graphical report or the chart here, the pie chart, it's divided. This is the the top 10 medication, and as you can see here, it starts from the largest slice and it goes to the smallest slice. And we can see here from this graph that the green part or the green slice, this is the top medication, which is paracetamol, and this is in this month, as you can see here. So we can see the remaining medication. So this is the top 10 medicine. If we go to see the second report, so this is the patients via nationality. This report doesn't have a filter. It will show all patients divided into their nationality. So we can see that in this center we have the total patient is 1,864, and these patients are divided by here in this example data to Syrians and Iraqi. So the Syrians is 82% and the Iraqi are 17%. And you can see here the need help and don't need help. So this also concept means that a patient might go to the center and he can pay money, so he don't need help. In this case, we can tag this patient as he doesn't need help. But if the patient needs help and he can't pay for the services and medication, in this case, we need to tag this patient as need help. Usually in a disaster situation, most of the patients needs help. So this is the second report, which is the patients via nationality. If we go now to the third report, which is top 10 procedures or services, also in this case we will specify which year and which month. We can see here that for this month and year, the total number of procedures or services is 602, and we can see that the top, and this is the top 10 services here. So the first one is a regular check service or procedure in the general clinic, GP, and then there is a check service for children, and so on. So these are the other services. So currently these are in Arabic, but they can be in English if the center wants it to be in English or any other language. And this is the top 10 services and the number, how many times this service was given to patient during this month. So this is the top 10 procedure or services. And then we have this report about the consultations per clinic. Also, we will specify the same year and month. We can have any date that we want, but this is just for the example. So in this case, if we see this report, also it's a pie chart report, and in this pie chart it shows the division of services between clinics. So we can see that the general clinic has the most consultations, and then we have the pediatric clinic has the second one, and then we have the obstetrics clinic has the third one. Let's go now to this report, visits per month. Also we need to specify the year and the month here, and when we generate the report, this report will show us the number of visits in a specific month, but we break the numbers into days. So per day I can see the number of visits. So the total as you can see here, this is the same chart but in a different format. So we can see for each day in this month how the visits varies between the days. This report can give us information if we have like a specific event in that day, like a big disaster that happened in that day. You might see that the visits in that day or date might increase dramatically. So these reports can give us like an indicator to see what happened in that date. It might be an event, an incident, or something that increases the number of visits for patients in that month. Now we will go to the next report, which is the top 10 disease per country. So let's generate for the same year and month. If we generate the report here, we can see for the two nationalities that we had, which is Syrian and Iraqi, we can read based on the top 10 diseases. So we can see that this is the ICD-10 code J04 and this is I10. So this is, and the red column is the Syrian and the green column is the Iraqi. And as you can see here, this is the top 10 diseases, and this is the number of patients in this month for this disease. So this is the Syrians, and the top 10 diseases, as we can see here, are explained in this table. And if we go to the second page, we can see the Iraqi breakdown for the top 10 disease, and also we have the explanation table. Let's go now to the next one, which is the top 10 disease per age group. So if we also specify the year and the month, so this is uh, the same top 10 diseases but divided into age groups. So this is the first one, which is older than 18. We can see the top 10 diseases for that category, older than 18. We can see these are the main top 10 diseases, and other diseases are grouped into this big one. And also we can see the explanation. This is for over 18. You can see this is the main one, I10. And if we go to the next page, this is the other group, which is ages between 5 and 18. So between 5 and 18, we can see a difference in the top 10 diseases. And this is the explanation of that. And this is the last age group, which is less or equal than 5. And this is the top 10 diseases or diagnoses. So this is the top 10 diseases per age group. Now let's continue and go to the next report, which is let's take this one, top 10 diseases based on the gender or sex. So also let's specify the year and the month. So the same concept, but now it's divided to males and females. So for the males, we can see that this is the top 10 disease this one. This is the all diagnosis, other diagnosis, but this is the main one, which is J04, and this is the second one, and so on. So these are sorted from the biggest to the smallest. If you continue and to see the female part here, so we can see it's also J04. So maybe if we select a different month, maybe this month is cold. So if we go to another month in this year, we might have different diagnosis. Or maybe the area has a lot of pollen. So this is the male, and this is so here in the female it's different. You can see it's dental care caries. Sorry. So this is the top 10 diseases based on gender. Um, Now let's take the top 10 diseases in general without any breakdown. So in this case, we can see the top 10 diseases based on this year and month, as you can see here. And finally, this is the report that shows the patient visits and consultation all together in one report. So let's select a specific year. So let's select the same month that we had before, which is October in this case. Or we can select a time range. So we can select from January 2009 till October 2009. And here we can select if you want to only see the patients who need help or everyone. So I'll select all patients. And also we can specify it only to locals, which is in this case, if we install this application in Syria, it will be Syria. But I will select all nationalities and generate the report for them. So this report is interesting. So it will tell you how many patients visited us during this period, and how many visits are there in this period, and how many consultations are there. So as you can see here, the relation, this is greater than or equal this is greater than or equal this. Now if we go to the first one, so this will show us the visits in green and the consultation in blue. So starting from January, we can see that the consultations is more than the visits. But after that, for some reason, for each visit, a patient only do one consultation in this period. If you go to the next page, this will show us the patient, the number of patients during these months, and the final chart will combine all of these together. So as you can see here, these are the visits in blue, in green, the consultation in blue, and the patients in red. And you can see here how these numbers are different. So this was the final report in the graphical report. Now we will go to the third category, which is the nutrition report. These reports are related to children in general. So whenever a child comes to do a visit, usually if he's under the age of 5, um, we need to take his height and weight. In this case, these reports will be generated based on that information. So let's take the first one, nutrition male female report. In this case, we need to specify which time range we need to generate the report against. So I will use the same time range that we used before, which is October. Also, I will select all patients and all nationalities for now. So by viewing this report, we can see that the general number of patients and the visits and the consultation here, but this report only focus now on the children or child, let's say, measurements. So we divide into male and female, and this is based on the weight. We can notice that we have underweight 11 male and 1 normal, and underweight 9 female. If we go to the second page of this report, it will focus on the height here. So we can see that we have 12 stunt, stunted and 9 female stunted, and so on. So this is the nutrition male female report. There is a second report for this based on another formula, which is called the growth report. If we select the same time and generate the report. So in this formula also we focus on the growth of the males and female children, and we can see here based on the growth formula that we have 3 males are uh, uh, they are wasted based on the the nutritions and growth and height, and we have 32 normal here. For females is 2 and 29, and so on. So this is the growth report. Finally, I need to explain the Excel report. So the Excel report will generate an Excel file based on the filter we enter here. So let's select all nationality, and let's select the all patients. Let's select the same year and month, and let's generate the Excel. So first I need to select where to save this file. I will select my desktop, and when the report is generated I will have this message, finish generating report. And if I go now to the desktop, I can see this report. So this report will have the year and month that we generated the report against. So if I open this report is considered like a summary for that month and year. So it will have most of the numbers that we saw in most of the reports in one Excel file. So as you can see here, we have the year and month. We have the center code or the clinic code, the area, and then we can see the breakdown for all patients, and so the patients are divided into new patients and repeat patient, and we are dividing this number into age group and also based on the gender. And as you can see here, we have the total for each one. So also we can see this pie chart based on this table. So if I click here, you can see which age group. uh, Here it's the between 18 and 59 who visited us more. Also here we can see based on gender, we can see that female patients visits the center more in this month. And here you can see the percentage between new patients and repeat patients. If we continue, we can also have this patients per nationality, also breakdown of the numbers based on the nationality, so other nationality and the local nationality, also the breakdown based on age groups and gender. Here we have the number of full-time doctors working in the center and how many days the center worked in that month. It's 26. And then we have a section that will show the top 10 chronic diseases in that month. So we can see here and the same age group breakdown and gender breakdown. If we want to see more information about this disease, it's like a link. We click on it and it goes to this legend that will show us the explanation of these top 10 chronic disease and acute diseases. And also these pie charts based on the age and based on the top 10 diseases or the diagnosis. And this is the final one, which is the top 10 acute diseases. You can see here we have the codes and also the breakdown. And then we have the pie charts based on the age groups and the top 10 diagnoses. And the last part, if we have a referral clinic, so we have two types of clinics. Either an inside clinic, which the center have, or an outside clinic. So any outside clinic is really a clinic in another hospital or another bigger center. So we call these referrals. So if we have this case of data or this data in our system, it will show here. This is the final report. I hope you enjoyed the explanation. And if you have any question, please send me an email. I will put it in the video description. Thanks a lot.